Hello friend, welcome once again in our channel .pharma. So in this video we discuss the vitamins. Vitamins is the very important chapter as in point of the view of the GPATs and also in number of competitive exam. In each exam there is the must 2 to 3 question must be asked for 3 to 4 mark. So vitamins chapters, vitamins points which is the very important, and these vitamins also important as related to the humans and number of the organism. They play a critical role in normal body functions and normal human functions and number of organism function. So vitamins is important. In this video we discuss the vitamins, their chemical name, their structural ring, and their deficiency. So the vitamins which is the defined as vitamins is the organic compound which is required in a diet. So it is an organic compound required in a diet in small amount, because small amount they are not synthesized in our body. They take externally from the diet and supplement. So the vitamins which is also synthesized in your body in very small or very minute quantity. When a concurrent administration of the antibiotic with vitamins, they inhibit the normal microbial gut flora. So in our gut there is the number of the microorganism, number of the bacteria, they synthesize the vitamin, but antibiotic they kill the microbial flora and inhibit the activity and inhibit the synthesize activity of the bacteria. So bacteria will get killed and vitamin is not synthesized. So antibiotic should maybe not administered with vitamins. So vitamins is the organic compound required in a diet in a small amount to perform a specific biological function or normal growth and health of the organism. So vitamins is the very important. Now vitamins which is classified into the two categories. First one is the water soluble vitamins and next one is the fat soluble vitamins. In that, first one is the fat soluble vitamins. In that, the fat soluble vitamins further divided into the vitamin A, vitamin D, vitamin E, and vitamin K. So in that, first one is the vitamin A. So vitamin A which is also called as the retinol, which is the vitamin A1, and dihydroretinol, which is the vitamin A2. This is the two type of the vitamin A, A1 and A2. The ring present in vitamin A is the beta iodine ring, and vitamin A deficiency lead to the night blindness and xerophthalmia. So xerophthalmia which is the dryness of the eye, just related to the our night blindness. So vitamin A lead to the deficiency of the night blindness and xerophthalmia. Next one is the vitamin D. Vitamin D also called as the ergocalciferol, which is the vitamin D2, and cholecalciferol, which is the vitamin D3, and ring present in a vitamin D3, which is the steroidal nucleus. The ring which is the in number of the exam they ask the in which vitamin there is a presence of the steroidal nucleus. So vitamin D is the vitamins which there is a presence of the steroidal nucleus in their structure. So deficiency of the vitamin D lead to the rickets in children and osteomalacia in adult. So this about the vitamin D. Next one is the vitamin E, and vitamin E is also called as the tocopherol, and the ring present in the vitamin E is the chromium ring, and vitamin E deficiency lead to the infertility. So vitamin E imbalance lead to the infertility. Next one is a vitamin K, and vitamin K which is the act as a cofactor in number of the body components. So they classified as the K1 phyloquinine, K2 minoquinine, K3 menadione, and their ring present in vitamin K is the naphthoquinine, and vitamin K deficiency lead to the inhibition of the coagulation. So there is the vitamin K which act as the anticoagulant, and further deficiency of the vitamin K there is the loss of the anticoagulant activity, means inhibition of the coagulation will be occur. So next one is the fat soluble vitamins, and next one is the water soluble vitamins, and water soluble vitamins further classified into the B complex and C also called as ascorbic acid. So first one is the vitamin B complex, and in that B complex is the vitamin B1, and vitamin B, their chemical name is the thiamine, and structural ring which present in that the pyrimidine ring attached with the thiazide ring. So in that pyrimidine ring attached with the thiazide ring, and their deficiency lead to the beriberi. So vitamin B1 deficiency lead to the beriberi and also called as the thiamine. Next one is the vitamin B2, which also called as the riboflavin, and structural ring is the isoolexin, and deficiency lead to the red tongue in that. So vitamin B2, which is also called as the riboflavin. Next one is a vitamin B3, which is also called as the niacin. This is also called niacin, and their structural ring is that the pyridine 3 carboxylic acid, and vitamin B3 lead to the deficiency pellagra. So there is a disturbance in the level of the B3 lead to the pellagra, and also called as the niacin. Alternative name is niacin. Next one is the vitamin B5, which is also a water soluble vitamins, and they also called as the pantothenic acid, and structural ring which is a pentoic and beta or P-alanine, and their deficiency lead to the rheumatoid arthritis. Rheumatoid arthritis, it is a joint disorder. Next one is the next one is the vitamin B7 and vitamin B6, and vitamin B6 is also called as the pyridoxine, and containing the pyridine structural ring, pyridine parental ring, and vitamin B6 deficiency lead to the neuropathy and convulsion. So vitamin B6, which is also water soluble vitamins, and chemical name is the pyridoxine, and there is the pyridine structural ring. Next one is the vitamin B7, which is also called as the biotin, and structural ring in that there is the imidazole and thiophane ring, and deficiency of the vitamin B7 which lead to the hair falling. So next vitamin is the vitamin B9, which is also water soluble vitamins, and their chemical name is the folic acids. The structural ring is the three type of the ring attached to each other, means there is a complex in structure. There is a pteridine ring PAVA, that is para-aminobenzoic ring, and glutamic acid ring in the structure. And the deficiency of the vitamin B9 is the megaloblastic anemia. So there is a deficiency of the vitamin B9, the person suffering from the megaloblastic anemia. Next one is the vitamin B12. In that they also called as a cyanocobalamin or cobalamin, and the structural ring which is the corine ring with the central cobalt atom, and there is a deficiency between in the person suffering from the pernicious anemia. So vitamin B12 is the very essential, and other vitamins also essential. Next water soluble vitamins is the vitamin C, which is also called as the ascorbic acid, and structural ring in that there is a hexose ring just resemble to the monosaccharide structure. So in that hexose ring which is a structural ring, and vitamin C deficiency lead to the scurvy. So all vitamins is important, and their imbalance between lead to the deficiency. So this deficiency hazardous or serious action may be produced, or toxic action also produced. So this about all are the vitamins. Number of the competitive exam and also GPAT exam must be asked in the point of number of the questions should be asked. So thank you friend for watching our video. Please like, comment, share and subscribe our channel. So thank you once again.